Hello. Today we are talking about microsuction clearance of the ears. Microsuction clearance of the ears is a commonly performed procedure in the ENT outpatient clinic. There are a number of reasons why we perform microsuction clearance of the ears. Most commonly, we want to remove wax from the tympanic membrane. This can allow visualization of the tympanic membrane and allow you to make a diagnosis. Equally, wax filling the ear canal can cause an uncomfortable blocked feeling within the ear or an itchiness. Removing the wax will alleviate this feeling. When wax is impacted onto the tympanic membrane, this can cause a hearing to decrease, and removing the wax will alleviate that. In infectious and inflammatory conditions such as otitis externa, removing debris and mucopurulent discharge from the ear canal can help speed the resolution of this condition. In conditions like cholesteatoma or chronic suppurative otitis media, microsuction may be an adjunct to their treatment by removing debris from the middle ear or the ear canal. Lastly, in patients who have undergone open cavity mastoid operations, they may have a very large open external ear, and this has a tendency to collect wax and debris which can be cleared using microsuction. This slide shows the anatomy of the external ear. Beyond the pinna lies the ear canal, and this is the area in which the wax and debris accumulates. Beyond this is the eardrum, and the aim of the microsuction is to remove the debris and wax from the ear canal such that the tympanic membrane can be seen clearly. A variety of equipment is required in order to perform microsuction. Traditionally, the procedure is performed using a couch to allow the patient to lie flat and still during the procedure. A suction unit will be required, and suction ends, usually a Zollner sucker, will be used. Zollner suckers come with attachments known as fine ends, which allow for more precise removing of wax from various parts of the tympanic membrane. A speculum is used to hold the very external cartilaginous part of the ear open and allow easy access to the ear canal. A microscope is used to demonstrate the ear canal in detail, to provide light to the ear canal, and usually this is secured without the need of your hands in order that your hands may be free to perform the procedure. Additional tools are often required, such as wax hooks, Jobson horn probes, occasionally needles, and crocodile forceps in order to remove parts of debris that may not be amenable to suction. Before performing the procedure, it's important to prepare the patient. There are a number of things that you should warn them about. Firstly, the procedure is very noisy. The suction can be heard clearly throughout the room, and when this is placed in the patient's ear canal, the effect is magnified and patients find the procedure quite noisy. It is important that the patient doesn't move, because movement with a suction catheter within the ear canal can cause bleeding or damage to the tympanic membrane. The patient should also be warned that the procedure may be uncomfortable and rarely painful. Pain tends to come from the instruments touching the external border of the ear canal. The procedure is very variable in the length of time it can take. It can take 15 to 20 seconds or 5 to 10 minutes. Patients with mastoid cavities often have longer procedures. In order to position the patient, the couch should be placed at a comfortable height with the patient lying supine on it and the head turned away. The microscope should be approximately 30 centimetres away from the ear canal, and you should be comfortable, and the patient should be comfortable in this position with the ear canal facing you such that you can access it easily with both hands. There are a number of techniques used in microsuction clearance of the ears. The first technique that we'll describe, looking at the instruments, is suctioning. The first instrument is the oral speculum. The speculum is inserted into the external part of the ear, and it holds the hair and cartilages around the entrance of the ear canal open to allow access into the deeper part of the ear canal. The next piece of equipment is the suction end, the Zollner suction end. This end would be attached to the suction unit via tubing. This particular Zollner suction end has a fenestration whereby the finger can be placed over or removed from the fenestration to change the power of the suction. The Zollner end passes through the oral speculum and picks up wax from the external part of the ear canal, moves it into the central part of the ear canal, and then removes it. This comes with a stylus which can be used to unblock the Zollner suction end should it become blocked. Another attachment for the Zollner suction end is the fine end. This is just a smaller piece of tubing that inserts into the Zollner suction to provide a quieter, finer and more accurate way of removing wax and debris. The next technique that we will describe is the use of other tools such as the wax hook and the Jobson horn probe. The first is the wax hook. The wax hook may be inserted beyond a hard lump of wax that may not be removed by suction, and then rotated such that the hook catches the wax, and this can then be removed. It is important that the hook does not touch the wall of the ear canal, as this may cause the patient pain and bleeding. The next piece of equipment is the crocodile forceps. The crocodile forceps are fine forceps that may be inserted within the ear and used to grasp pieces of debris or foreign bodies that may lie within the ear. Once grasped, they can be removed from the ear canal. And the last piece of additional equipment is the Jobson horn probe. This may be used to sweep around the side of the ear canal without touching the wall in order to clear debris that may be lying loose within the ear canal. At the end of the procedure, when the wax has been cleared, the tympanic membrane should be observed clearly. As you can see, the tympanic membrane in this patient is intact. You can see the handle of the malleus, with the tip of the malleus marking the central point of the eardrum. The light reflex can be seen in the antero-inferior quadrant of the eardrum. The lower part of the eardrum is known as the pars tensor, and the superior part of the eardrum, the pars flaccida. The pars flaccida leads into the attic area of the ear, where cholesteatomas are most commonly, but not always, seen. Sometimes, in the postero-superior part of the pars tensor, you can see the impression of the incus coming down from the attic and the stapes heading onto the oval window.